So we're
Yeah.
doing a number of those studies, but at the end of the day, it is amazing how we need to do those studies for people who claim to be real. You need to have all those studies. It's part of a I'm not saying they're not valuable. I'm not saying they don't have their place. I'm not saying any of that. All I'm saying is that they're part of a global brainwashing because you can have something that works without having all those studies. But at the end of the day, when we talk to many doctors, many clinicians, and we show those studies, it's almost like they want to see those studies, but what we really speaks to them is a case. So as we document one case with medical records and we show the before and after, now the doctor thinks, oh, I have 10 patients like that. That is the trigger for a lot of people, is what you just talked about. Somebody has great results and just say, okay, let me give it a try. So we need to do the whole gamut of it. So we are doing the clinical trials. It's expensive, it's long. We're doing them. But I can tell you by experience, it is not what moves people. What moves people is a story of
Yep.
somebody who comes and says, here's what happened to me. And that story is credible. And people say, okay, let me see what it can do for me. Because at the end of the day, a study is great, but a study is what happened in those 1,000 people. It's not in you. Whether it's going
Mm,
to work in you, you can only know by trying it. So
I
at
I
the end of the
completely agree.
day, you can say, okay, let's skip this study.